Welcome back to Ozarks Fox AM. I'm excited to have a real-life doctor in studio. It's Dr. Luke Van Kirk from Command Family Medicine. He is here to answer some questions because we all have questions about COVID-19. It's all in the news and anybody's talking about because it's affecting everybody.
That's right.
And full disclosure, I do want to say this is my doctor. I text him and said, would you please come on the show to kind of ease our minds, because Dr. Luke, you and your practice have sent out over the past few weeks some very informative emails that I have appreciated because it's coming from my doctor.
Right.
And you have a way of wording them that doesn't set panic, but it's informative with facts. So thank you from your patients, first of all.
Oh, you're welcome.
And
I'm glad that's the case.
It is. You really institute. I felt calm after reading them. But the big question, Dr. Luke, is COVID-19. What is the difference? A lot of people on social media.
Right.
What is the difference between COVID-19 and the regular flu, and why is this so scary?
The main difference is that we don't know all the information yet, and the mortality rate right now looks like it could be a lot higher than what the flu typically is. And so if the mortality rate really is 2 to 3%, then we're looking at a lot of deaths down the line. If it's closer to what flu typically is, then it's not as scary, but we just don't know that information right now, and so we have to go off what we have and take the appropriate measures to prevent that.
Oh my goodness, and that's changing every day. We're learning more all the time, isn't that right?
Correct.
So you're staying, abreast to what's coming down the pike as well. So COVID-19, is COVID just a certain strain of flu? And 19 is this is the 19th one that's come along?
Yeah, I don't understand it either.
I honestly don't know where the 19 comes from. It's a strain of the coronavirus that there's several other strains out there that we've probably all been exposed to, part of the common cold virus. And so this is just one that our bodies haven't seen before, so we don't know how we're all going to react to it. And so we're just we're learning as we go along and taking the appropriate precautions.
What are the doctors and the experts thinking about the duration? We have what we call flu season.
Right.
It gets warm. You don't really hear about people getting the flu in the summertime. I mean, are we hoping it lasts just flu season instead of being a longer pandemic throughout the year?
That's what we're hoping, yeah. Since it is an upper respiratory virus, they typically peter out in the next month or so, and so we're hoping that that's the case and that we can back off on these social distancing measures and hopefully start returning back to normal life.
I'm glad we are taking the measures, though. We've never seen anything like this in all of our lifetime, have we? And I don't think any of us have.
No.
I'm sorry, I lost my train of
That's okay.
thought.
I'm curious, can I ask this about what symptoms should you look for?
That's what I was going to ask.
Yeah, because I'm curious, because I
read my mind.
I know, because I know exactly where, because we talk about this all the time. It's like, what should we look for? My mom actually called right before the show and said, ask your doctor about this for me.
Yes.
So I'm, of course, getting my medical advice from the doctor. What are the symptoms we should look for?
So the main ones we're seeing are going to be fever, dry cough, and then fatigue. And so there's a lot of other symptoms that can go along with upper respiratory viruses, dry, a scratchy throat, ear pain, runny nose. We're not seeing those symptoms as much with the coronavirus, and those symptoms can show up later, anywhere in a 14-day window. A lot of people are showing symptoms within the first 5 days or so, 5 to 7. Some people may not show symptoms at all, but
that's what's really scary too, isn't it? That we don't show symptoms for a while, or somebody might be exposed and then never really come down with it.
Right, yeah, and that's kind of the big reason for these extreme social distancing measures is some of the places that are doing more widespread testing and not just the symptomatic people are seeing a high percentage, over 50% in some places, that are asymptomatic. And so that's why we're taking these extreme measures, because people aren't going to know if they're the ones out there spreading it. The tests they're doing, the viral loads are just as high in a symptomatic person or an asymptomatic person. So you're just as contagious whether you have symptoms or not. And so that's why we're really being cautious right now.
Right. Do you know then if, let's say you have some symptoms, how then do you as a person know, should I go to the doctor, should I call the doctor?
Right.
Because I wouldn't know if I got that. I would think I had the flu. And then I don't know what the chances are of then turning into COVID, and what are the next steps you should take then if you have those symptoms?
Vast majority of people, if you're healthy, you don't have any comorbidities like COPD, diabetes, or you're undergoing cancer treatment, things like that, vast majority of people are going to have mild symptoms. And so if you have mild symptoms and, the best thing to do is just self-quarantine, take, the proper social distancing measures, stay home. But if you have those comorbidities, that's when you want to reach out to your physician, or if you have more severe symptoms, if you have shortness of breath, then you need to reach out and pursue testing or go to the emergency room. But if you're considering going to the emergency room, you need to call ahead and let them know so that they can take proper precautions and make sure you have a mask when you come in and you're not exposing people.
Right, and we're also looking at, this is a wonderful flowchart that Dr. Luke sent out in one of his emails to his patients that I received. It's a flowchart telling you what you should do in the case you have the symptoms and who you should call and what order to do it and what symptoms you have. We'll post that on our social media as well after the show, so you can really dive into that, because that was helpful to me as well.
Absolutely.
Yeah.
And Dr. Luke, what are some things you're doing in your office to kind of help with this situation?
Yeah, so in our office we do direct primary care, and so all of our patients have cell phone number and email and can get a hold of us really easily. We can do so we've switched to pretty much all telemedicine, unless absolutely necessary. You know, maybe someone needs some stitches and we can keep them out of the ER where you absolutely don't want to be right now if you can avoid it. And so we also dispense medications to our patients, so we're having people just basically do a drive-through system. We don't have a drive-through, but there's pulling up parking lot. We'll run the medications out to them to minimize any contact with us or us with them. And then we are also we'll be installing a locker system outside, a cell phone locker with combination locks that we can change, and we can put the patient's medications in there, and they can come pick them up without even have to interact with anybody. And so.
That's great.
That's key, I think, is just kind of keeping that self-quarantining, just because you were telling me before the show, and by the way, Dr. Luke is staying for another segment because there's way too much to cover in one segment. But you were saying, like, we're trying to prevent what's happening in Italy. They didn't take the precautionary steps of social distancing. That's why it's so prevalent in Italy. Is that correct? Correct,
yeah. We're wanting to avoid that, and so that's why they've jumped on social distancing as much as we have.
Right, and I think there's an older population as well in Italy.
Correct, yeah, generally older population.
And that's who is at higher risk, is the elderly and people with compromised immune systems?
Yeah, that's what we're seeing. Majority of people that are having complications from this are the elderly, and so I think it was the death rate in Italy, the people that have died in Italy, from what I'm seeing, the average age was above 70.
Wow.
Right.
It's still sad no matter what you think about it, the regular flu or COVID-19. You don't want anybody to have to die from that. You just need proper treatment. And
that's right.
Would you recommend, if somebody is self-quarantining and might have symptoms, is it just drinking a lot of water? I mean, what do you do at home to help yourself? Okay.
Yeah,
you know, I just got the I'm so sorry. Doctor, that was a tease. He's going to answer that coming up.
That's right.
We have so much more information to talk about.
And we'll get that here in just a little bit, but we'll be back with so much more right after this. Don't go anywhere.
Sorry, I get going. I have so many questions,
we have
Doctor.
more time.
Yeah, we have more time.
Yes.